Just the other day, a friend was telling me about their new puppy, this adorable little guy.
Oh, yeah.
Yeah, but then they mentioned something about, well, one of his testicles not being quite where it should be. And it got me thinking, how common is that sort of thing? What's the real story?
That's
Uh,
actually a super common question, and it leads us perfectly into today's deep dive.
okay.
We're going to be looking at cryptorchidism in dogs and cats. We've got some medical text excerpts here that really lay out the basics.
Cryptorchidism. Okay, sounds a bit technical. So just in simple terms, what are we actually talking about?
Right. Essentially, it's just when one or maybe both testicles don't make it all the way down into the scrotum.
They get stuck somewhere along the way.
Kind of, yeah. Think of it like they get a little delayed on their journey downwards.
Okay, a bit of a travel mishap downstairs. I get it.
Uh,
So our mission today is to sort of unpack what causes this, how vets figure it out, and, what it actually means for the pets involved.
exactly. Without getting bogged down in too much jargon, hopefully. So let's start with, well, how it should work, the normal process.
Right.
In dogs, generally we expect those testicles to descend fully by the time they're about 2 months old.
2 months.
It
Okay.
can happen later sometimes, but it's pretty rare after 6 months. And for beagles, it's actually super specific.
Oh.
Yeah, the texts mention they should be at the outer inguinal ring by day 5, then between that ring and the scrotum by day 15, and then fully down in the scrotum by day 40.
Wow. That is precise.
It is. So generally, if you can't feel both by 2 months old, cryptorchidism is, the likely diagnosis.
Yeah.
And interestingly, this is actually the most common congenital anomaly birth defect that we see involving the testes.
The most common. Really? How common are we talking then in dogs overall?
Well, the reports vary a bit, but they range from maybe under 1% up to potentially 10%.
Mm-hmm.
It does seem to be more common in purebreds,
Okay.
and especially toy and miniature breeds. They have a significantly higher risk, the texts say about 2.7 times greater than larger breeds.
2.7 times. Which breed specifically?
We're talking breeds like Chihuahuas, toy poodles, Pomeranians, Yorkshire Terriers, those sorts.
The little guys.
Yeah. Although, interestingly, some studies also show a higher risk in German Shepherds, Boxers, and even Staffordshire Bull Terriers in certain populations.
Huh. So it's not just the tiny breeds then. Good to know. Is it usually just one testicle that gets retained, or can it be both?
In dogs, it's much more often just one. About 75% of cases are unilateral.
Unilateral. Okay. Just one.
Right. Meaning only one testicle is retained somewhere up high. And here's another little quirk for dogs.
Yeah.
The right testicle is the one that's retained about twice as often as the left one.
The right one. That's weird. Any idea why?
The sources don't actually specify a clear reason for that right side bias in dogs. It just seems to be an observed pattern. Shows there's still stuff we don't fully understand.
Fair enough. What about cats? Is it common in them too?
A bit less common in cats. The incidence is reported between, say, 1 and 1.7%. And unlike dogs, they don't seem to have that right versus left preference. It's about equal frequency.
Interesting difference.
Yeah. And there's also a specific situation noted in miniature schnauzers that have something called persistent Müllerian duck syndrome in those dogs. The incidence of cryptorchidism can be as high as 50%.
50%. Wow, that's huge. So that really points towards genetics, doesn't it?
Absolutely. Which brings us to the why.
Yeah, the genetics behind it all. What do we know?
Okay, so in dogs, the exact way it's inherited isn't pinned down perfectly, but it's strongly believed to be complex. Likely what we call polygenic recessive.
Polygenic, meaning multiple genes.
Exactly. Not just one gene, but probably several involved, and it acts recessively, meaning an animal might need to inherit the right combination of these hidden genes from both parents to actually show the condition.
So parents could seem fine but still carry the genes.
Precisely. That makes it really challenging for breeders. You can't always easily spot the carriers just by looking at them. It means looking closely at family history, the pedigree.
Right. It's definitely considered heritable, though.
Oh, yes. Very much so in dogs.
And cats. Is it genetic there, too?
Well, there's a suspicion it might be inherited in cats, but the data isn't quite as strong or clear as it is for dogs.
But maybe some link?
Possibly.
Hmm.
Persians, for example, seem to pop up more often in surveys, which might suggest a genetic component in that breed at least.
Okay, so we know who gets it, and that genetics is a big factor, especially in dogs. But what does it actually mean for the animal? What are the consequences?
Good question. Well, firstly, fertility. If both testicles are retained, that's bilateral cryptorchidism, the animal will be infertile.
Makes sense. They're not where they should be.
Right. But if only one is retained, the unilateral cases, they're usually still fertile.
Okay.
Now, initially, you might not see any signs, no obvious pain or illness, just from the testicle being in the wrong place.
So it can go unnoticed for a while.
It can, but
Uh-huh.
here's where what comes in, and it can get pretty serious.
Uh-oh.
Retained testicles have a much higher risk of something called spermatic cord torsion.
Torsion, like twisting.
Exactly. The cord that supplies blood to the testicle twists on itself, cutting off the blood supply.
Mhm.
It's extremely painful, a real emergency.
Ouch.
And here's the kicker. In about 36% of those retained testicles that twist, they're also found to be cancerous.
Wow, 36%. That's a pretty high link between torsion and cancer then.
It is. And that leads to the other major concern, cancer itself, even without torsion.
Right.
Retained testicles, especially those in the abdomen where it's warmer, are significantly more likely to develop tumors later in life, specifically Sertoli cell tumors and seminomas.
Sertoli cell tumors. I've heard of those. They can cause other issues too, right?
Yes, exactly. Some Sertoli cell tumors, particularly in retained tests, can start producing excessive amounts of estrogen.
Estrogen in a male dog.
Yep. And that leads to what's called a feminizing paraneoplastic syndrome.
Feminizing. What does that look like?
You might see things like enlarged mammary glands, gynecomastia, or symmetrical hair loss, usually on the trunk and flanks,
Yep.
maybe darkening of the skin in the groin area, a droopy preputial sheath, and even changes inside, like prostatic issues.
Gosh, that sounds like a whole cascade of problems just from one testicle being in the wrong spot.
It can be, absolutely, which is why addressing it is so important.
So, given we know it's likely genetic in dogs, what's the general recommendation for breeders?
The standard advice is pretty clear. Affected males should be removed from breeding programs.
To try and reduce it in the breed.
Exactly. Since we think multiple genes are involved, not breeding affected dogs is seen as the most practical way to try and lower how often it occurs over generations.
Takes sense. Are there any non-genetic factors, like environment or anything?
Interestingly, while things like low birth weight are considered risk factors in humans, the sources state that similar non-hereditary factors haven't really been reported or confirmed in dogs. It really seems to circle back to genetics for them.
Okay, so responsible breeding is key. Now, how do vets actually nail down the diagnosis? I imagine it's not always straightforward, especially if you can't feel anything.
Right. The first step is always a good physical exam, usually starting around that 2-month mark we talked about, carefully feeling the scrotum and along the inguinal canal.
Trying to find them.
Yep. But you also have to consider other possibilities. Could the animal have already been neutered? Maybe.
Oh, right. Someone might not know the history.
Exactly. Or maybe just the descended one was removed if the other was retained. And then there's a very rare condition called anorchidism,
Which is?
where the animal is actually born without any testicles at all. Very uncommon, but needs to be ruled out. It's different from cryptorchidism because the tissue just never developed.
Got it. Any other clues?
Well, in cats that are bilaterally cryptorchid, both retained, sometimes their behavior gives it away, they might still have that strong urine odor and act like an intact male tomcat because the retained testes are still producing testosterone.
Ah, behavioral hints. What about actual tests? Blood work or imaging?
Yeah, there are helpful tests. One is the HCG stimulation test.
How does that work?
Basically, you measure baseline testosterone, give an injection of HCG, which mimics a hormone that stimulates testosterone production, and then measure testosterone again after a certain time.
And what does that tell you?
If there's functional testicular tissue present, whether it's scrotal or retained, the testosterone level should significantly increase, often doubling or more.
And if the dog was castrated?
Then the baseline testosterone will likely be very low, maybe less than 0.1 nanograms per milliliter, and it won't rise after the HCG injection. So it confirms there's no testicular tissue.
Clever. Any other tests like that?
There's also a commercially available blood test, particularly for dogs, that measures canine anti-malarian hormone, or AMH.
AMA?
Yeah, it's produced by Sertoli cells in the testes. So if the test detects AMH, it confirms the presence of testicular tissue, whether it's descended or retained. It works for both unilateral and bilateral cases.
So good options for confirming if testes are present. What about actually finding the retained one if you can't feel it?
That's where imaging comes in. Transabdominal ultrasonography and ultrasound of the belly is really useful.
To actually see it.
Exactly. You can help locate the retained testicle, see if it's in the abdomen or maybe stuck in the inguinal canal, and check its size and appearance before surgery. It's often recommended before doing a laparotomy, which is traditional open surgery, or laparoscopy, the keyhole surgery approach. Helps the surgeon plan.
Makes total sense. plan the search. Okay, so diagnosis involves feeling around maybe blood tests like HCG or AMH and potentially an ultrasound. So once it is diagnosed, what's the plan? What are the treatment options?
The standard recommendation, the gold standard really, is castration. And importantly, that means removing both the retained testicle or tests and the normally descended one if it's a unilateral case.
Remove both, even the one that's in the right place. Why?
Primarily because of the heritability aspect we discussed. You don't want a unilaterally cryptorchid dog who is likely fertile passing on those genes.
Ah, the breeding implications again. Got it. What about that procedure some people used to talk about, orchiopexy, surgically moving it down?
Yeah, orchiopexy is where they surgically pull the retained testicle down and fix it into the scrotum. It's generally frowned upon now, or at least considered less favorable by many vets.
Why is that?
Well, even if you put the testicle in the scrotum, it doesn't remove the increased risk of cancer that comes with having been retained.
Oh, right. The damage or the predisposition is already there.
Exactly. The thinking is that the exposure to the higher body temperature while it was retained might have already initiated changes that increase cancer risk. Plus, you're potentially making a genetically affected animal appear normal, which has ethical considerations for breeding.
That makes a lot of sense. So castration is the way to go. I thought I read something about hormones maybe helping young dogs. Is that ever used?
Yeah, there is some, let's call it anecdotal evidence, that using hormones like HCG or maybe GnRH might encourage testicular descent in very young dogs, like younger than 4 months old. Yeah, it's considered pretty unreliable, especially after they hit about 16 weeks of age. Once they're past that point, the chances of hormones working are thought to be very low. So while a vet might try it in a really young pup as a long shot, it's definitely not a standard or guaranteed solution.
Okay, so not something to rely on. Castration is really the main recommended path. What happens long term if you don't do anything? If you just leave the retained testicle?
Well, that brings us back to those major risks we mentioned. The risk of testicular cancer is significantly higher.
How much higher?
The figure often quoted from studies is around 13.6 times greater risk compared to dogs with normally descended testicles. That's a big increase.
13 times. Wow.
Yeah, and a large proportion of Sertoli cell tumors and seminomas specifically are found in these retained testes, so a huge cancer risk.
Yeah.
And then there's that risk of spermatic cord torsion we talked about, the twisting. That's an acute, painful emergency that's also more likely with an undescended testicle.
So serious potential problems down the road.
Definitely. And it's worth remembering that testicular migration, the testicle moving down on its own, is really unlikely after about 4 months of age and considered extremely rare after 6 months. Waiting usually doesn't help.
So don't wait and hope, basically. Early detection and castration seem key. You mentioned specific hormone protocols earlier, just briefly.
Right. For those very young dogs under 16 weeks, the HCG protocol typically involves injections, maybe 100 to 1,000 international units, given intramuscularly, maybe 4 times over 2 weeks, but again, often unsuccessful after 16 weeks.
And the GnRH.
That's sometimes tried in puppies between 2 and 4 months old. Dosages vary, maybe 50 to 750 micrograms given 1 to 6 times, but same caveat applies: variable success rates, not guaranteed at all.
Okay. So bottom line, while those exist for super young pups, castration is still the most reliable and, frankly, ethically sound approach because of those ongoing health risks, right?
That really is the main takeaway message. Cryptorchidism is common, especially in certain dog breeds. It almost certainly has a genetic basis in dogs.
Right.
While unilateral cases might not stop them being fertile, both types carry those significant risks, cancer and torsion being the big ones.
So castration is the answer.
Castration of both tests is the strongly recommended course. It addresses the health risks to the individual and prevents passing the condition on.
Okay, so let's recap the big points then. It's common, especially in some breeds, particularly smaller dogs, but not exclusively. Genetics definitely seems to be the main driver in dogs. A dog with one retained testicle can often still be fertile, but the real worry is the massively increased risk of testicular cancer and also that painful torsion issue.
Yep, those are the key risks.
And the standard recommended solution is castration, removing both the retained one and the descended one.
You got it. And that actually brings us to a final thought, something for you, the listener, to maybe chew on. Given what we know about cryptorchidism being heritable in dogs, what does that mean for the bigger picture? What are the sort of broader ethical considerations when it comes to breeding practices for conditions like this that we know can be passed down?
Yeah, that's a really interesting question. It makes you think about, individual pet health versus the health of the breed overall. Lots to consider there.
Definitely something to think about.